I'm here to check in for a subacute shot.
My name's Christopher, and I've been battling substance abuse for a while. It's been, I want to say, almost like 8 years. I started using pills, and then one of my friends ended up introducing me to heroin. And it took me down like a rough path, and I ended up being in prison for some choices that I made that were wrong. So when I was in prison, incarcerated, I found out about this MAP program.
Go ahead and have a seat. I'll start with your vitals.
Okay.
Orange County has relatively high rates of opioid overdose compared with California and all of our surrounding counties. So it's definitely a need, and we are really striving to meet that. KCS is very nimble, and we're always willing to try new things that we think can help improve access and medical care for our patients. And we've spent the last several years really building a workforce that has the skill set and an excellence in treating these patients. For our MAP patients, we offer various telehealth options for them. One is to see a remote provider where we still have them come into our office and go into a telehealth room, and then we can do all of the ancillary services here like labs. And then we also allow patients to join from home by Zoom.
So this is your third shot at 300 milligram?
Yeah.
You want to step down to the 100 milligram yet? Or
Yes.
The KCS MAP program is basically a program that is the spectrum of services. Yes, they could if they really wanted to just come in and just get the medicine, but that's not what we recommend at all. I think behavioral health component is one of the most important parts. I think telehealth and BH, they go well together.
I've experienced a lot of pretty hard things, and I feel that therapy would be beneficial for me. There's a lot more I need to work on rather than just abstinence. I am 26 and I have been battling substance abuse disorder going on 14 years. I ended up going to the emergency room at a local hospital and they referred me to KCS. It was a godsend. I found out they were actually centered in Anaheim. I live about an hour away. And so every single appointment that I've had has been telehealth. With the telehealth, they squeeze me in anytime I need it.
Hello, Richard. How are you?
I'm well. How are you doing, doctor?
I'm doing well. Thank you. You look good.
Thank you. It would have been impossible for me to be able to go in person. I have social anxiety, so the telehealth has been my saving grace.
We're not just trying to treat the one symptom, we're trying to kind of treat the whole person, right? And in order to do that, we also have to think about their mental health and kind of the impact that it has on their relapse. So to be able to kind of address that piece is also addressing a large piece of the puzzle in their MAT treatment as well.
So your craving right now is still 6 to 7.
Surprisingly, I have been able to really connect with a lot of my patients, and that's the feedback that I'm getting from our other providers too, is they prefer telehealth, which is interesting. Being able to foster a relationship is not always about just being in person.
Therapy is scarce for all across the board, unfortunately. So we kind of went in the route of being able to hire providers that are even not in California. A qualification essentially for hiring outside providers is really them coming equipped with basic technology skills. Ideally, we were looking for a candidate who's able to kind of jump in.
I just wanted to let you know that I appreciate what you guys do, and it's helped a lot.
Well, Richard, thank you for trusting in us. For opioid, it's a teamwork. We need to work together, and we have to work together to be successful.
What kind of positive things have you been noticing?
I get up in the morning and I don't have to worry about back in the days when I used to use a lot of drugs. In the beginning, I was very closed about talking to a counselor, right? Because I was like, who's this person? Found out through telehealth because of my provider, and he started telling me about it. And then I ended up asking him questions about it, and then I ended up liking it. Like, I got a great job, I got my family's great. What's helped me out throughout my journey is that knowing that I'm not alone in this journey by myself, And that's what's helped me out to be where I'm at right now, this program that I have. I've been clean for already 6 years now. It's like a blessing,
A lot of us are in situations where we don't have licenses, we can't travel, we're house arrested, or people are just coming out of penitentiaries and they need the help, but they don't know where to go, they don't know where to turn. But if you have a phone, it's right there.
Embracing technology like this is really the future of medicine. Allowing more flexibility for providers, for health systems and patients is really, I think, the wave of the future. And I have a hard time seeing us go back to, only offering in-person visits for every patient.
My family's growing. My beautiful wife is 7 months pregnant. I have a 3-year-old son, and I want nothing more than to be the man that I know I can be, and I know that they need me to be. KCS has definitely given me a second chance, and I don't know where I would be without them right now.